All right. Well, I'm excited today to be meeting with Suzanne. She's one of my students who has taken actually a whole bunch of courses with us. So go ahead and just tell our audience a little bit about yourself and what brought you into the holistic animal realm, pretty much.
Okay. Um, so I started out actually in project management, and I've always been holistic minded for myself and for my animals. And I ended up with a Doberman with a spinal trauma. And I didn't want to go the surgical route that I was being encouraged to do. So I looked at acupuncture for him, which at the time was a needle in a haystack to find in the DFW area. But I found it, and two of his acupuncturists said, man, he really needs massage therapy. His thoracic is so tight. And I'm like, okay. Well, I had just been laid off at my work, and I said, where do I go for that? No idea. And so that sparked the thought of, if it's not available to me, maybe I can do it and make it available. And so I just started taking training and learning. And I found that after a while, I was able to keep Rhett balanced and healthy and fully functioning. He got all his mobility back. And so I opened up my practice to help others.
Yeah, that's awesome. It's so cool how sometimes our own personal animals just kind of push us in the direction that we're supposed to go in. So
Yes,
that's pretty cool.
I think
Um,
wink,
what was that?
a God wink.
Yeah, definitely.
Yeah.
Yeah, so then after you did the massage course, I know you added a bunch of other modalities. So tell us a little bit about what else you're doing.
ANMR is one of my core things that I do in my practice. Red light therapy, photobiomodulation therapy, and Reiki energy. Everybody gets Reiki that comes to me. I also incorporate aromatherapy and kind of like a conglomeration of things, kinesiology, taping, and I just tailor everything to that individual animal and how they're responding to the different modalities. And it's been such a blessing. There are so many seniors that come to me with limps or even paraplegic, and they're able to walk again, or if not, just have more mobility. Maybe they can start going to the bathroom on their own and be easier at home to maintain.
Yeah, that's
Yeah.
awesome. It is really rewarding seeing how well these animals respond to these techniques. And for those who are watching and don't know, ANMR is animal neuromyofascial release technique. It's actually a technique that I teach. I developed it. And for me too, it's one of my like go-to techniques. And I tell everybody who takes our courses and is doing any kind of body work, if they have not looked into that technique yet, you definitely need to. Even my sister, who's a veterinarian and teaches a lot of ozone therapy, has used a way to incorporate that into her ozone treatments. So she said
Thanks.
it really helps her see where the animals need ozone injections. And she said it's amazing the results she's getting when she incorporates those two modalities. So definitely, yeah, if anybody wants to look into it, just check out our website because it's a really easy to apply technique, but so super, super effective.
Yes.
Yeah, so tell us, do you have like a story that you can share with everybody that would be just like a case study that stands out in your mind?
Um, I've got quite a few. One of them is a pug patient that came to me. He was 14 when I started working on him. And when he showed up, I wasn't sure if I could do anything at all, but it was my client's sort of Hail Mary. And she brought Winston to me. His eyes were glazed over. He could barely stand. He had had one cervical surgery due to IVDD and DM. And when they handed Winston back over to her post-surgery, they said, he'll be lucky to make it the year. This is going to wipe him out within the year. And later, as I worked on him every week, he got full mobility back. And his vet notes were that he was, quote, exceedingly mobile, end of quote. And because he was, kind of an active guy, and he was very happy to be able to prance around and play with toys again. He's sort of my poster child for what I call it rehabilitative animal massage therapy, to just really sink in how powerful this is. How beneficial.
That's really awesome. So does that veterinarian refer to you now? Have they asked how you went and did that yet?
Yeah, absolutely. I have a couple surgeons that refer, instead of doing surgery, let's see if this helps.
Yeah, that's amazing. I recently had a local vet practice. All of the vets there have signed up for the ANMR course, and they're incorporating it into their practice. So it's nice to see more vets being open-minded to this. And if it's not something that they want to do in their practice, which is fine, it's great if they can refer out to people like you.
Mm-hmm. Yeah, and I usually spend about 40 minutes, sometimes an hour per patient. So I like that I can take my time.
Yeah, that's awesome.
And if that means that the animal needs more time, because, to calm, figure out what we're doing, and be comfortable with that, then I don't feel rushed in a setting where I might only have that room for half an hour. So
yeah, definitely. So let's see here. So you talked about doing the different modalities, which is awesome. I do think it's really important for people to have kind of a toolbox of things that they can pull out. So what does it typically look like when you're trying to figure out what you want to utilize on a patient?
So I always start with Reiki energy, and after one or two treatments, the dog is on board. They know exactly what's going to happen, and I can get deeper in, and
definitely,
get my fingers in there and work on them. And sometimes with the ANMR tool, I start out with my fingers and then I use the tool. So full massage, hand work, pretty much always laser therapy on down their spine and anywhere that's bothersome to them. If there's an area that I cannot touch, the dog is just like, don't touch me there, it hurts. I'll start with laser and then I'll see if I can get my hands in there later and work on that. And I also do vibration therapy too. So it's like everybody gets Reiki hands-on. Sometimes the massage gun, I'll employ that. I have one patient that started out, he didn't want my hands on him at all. So I did all tool, and he was able to walk again and run up and down the hall. And he's a senior Chihuahua, so that's good.
Yeah, cool.
Everybody gets aromatherapy, and I also employ florals, and I put those on the dog with the aromatherapy.
Okay, neat.
Yeah.
So if somebody wants to bring an animal, what was that?
And laser acupuncture.
Oh, yeah. That's a great technique too.
And a MAR course when I took it. Yeah.
Great. If somebody wants to bring their animal to you, how do they get in touch with you? And tell them where you are. So do they bring the animal, do you have an office that they come to, or do you travel to them?
I have an office. So they come to my home office and I can be found. I work the Dallas-Fort Worth area, and my website is puretemple.org. Like you want to keep your body, your temple pure. Puretemple.
Okay. Awesome. So let's talk a little bit about your process going through these online courses, because I know a lot of people that are thinking about taking some of our courses aren't really sure if they can learn these techniques online. Is it really something that you can do and safely and efficiently, perform them? So tell them a little bit about your experience and how it was for you going through the courses.
Yeah, so this was really my first rodeo, and I know a lot of people that get into this have some type of veterinary background. Either they're a vet tech or they're in rescue. I had none of that. So I really wanted to do this starting out to help my Doberman, and I wondered, but the dog informs you how you're doing. And so as you go through the courses, as I went through the courses, I would try the techniques on him. And I knew when I got good, when I would be in the middle of my studies here in this room, and he would come up, nudge me, and turn his back to me so I could start working on his spine.
Yeah,
So,
it's cool how they get used to that and then they start demanding it.
and tell you where, and they'll move so you get the right spot. Um, so I've actually been asked that question quite a lot, and I tell people you definitely want to have an animal that you can practice on a regular basis, and one that you get to know so you know how what you're doing is making them feel. And my Doberman has always been very communicative, so I know exactly what's working for him and what's not. That was very helpful. And then when you see them maybe pick up a ball that they didn't feel like playing for a while, then you're doing something right. So yeah, then all the videos that you send in, and those are critiqued, so you know what you could do better. What you're spot on with is very helpful. So all the TA work was brilliant.
Yeah, and I try to let students know too, because a lot of times I think they get a bit intimidated by the videos and the assignments, and they're like, well, what if it's not quite good enough? So they just kind of stop at that point and they don't want to send it in. But just take a deep breath and relax. Send in whatever you can, because it's our opportunity, as you said, to critique you, not in a bad way where we're going to tell you, you did something horribly, but it's our way to kind of give you some advice and help you, and also give you some confidence, because a lot of times students are doing things better than they give themselves credit for. So we can let them know, everything looks okay. And then if you need to redo something, no big deal. You just redo it, resubmit it, and definitely just, have open communication and reach out to us, because we're here to help and we want to make it easy for students. So if people are feeling intimidated, just try to push through that, because it gets easier.
Absolutely. And yeah, I got better with my videos as time went on. And I really wasn't thinking of them beyond being a student and passing the classes. But afterward, those became things I could post on my website that helped explain what I did and helped pet parents make the proper decision for them.
Yeah, definitely. That's true. They can go ahead and use those videos for advertisements or whatever if they're trying to do once they start their practice. So tell us a little bit about your practice then. Where are you at now, as far as, are you doing this full time? Are you making a living doing it? Do you feel like there's definitely a need in your area for an animal body worker?
Definitely a need. There's just a handful of us, and I work. It's my day job, what I do, but I work limited hours. I'm actually a senior citizen, and I'm scaled back, but
Yeah, that makes sense.
But you could definitely use, if I wanted this full time, that could happen.
Great. Yeah. And I do think, because a lot of people ask, like, is there a demand for it? And obviously it's going to vary a bit depending on where the person lives. But I do think, especially with small animals, the demand is rising, and we do need a lot more small animal therapists. Horses, there might be a bit more equine therapists out there, because horse owners have been open to therapy for their horses for a long time. But still, depending on where they are, there is a demand for more equine therapists too. But definitely the small animal area is definitely a place where I think people could build a pretty good practice doing that.
Yeah, I'll have Google ask me, do I want to buy an ad or something, or am I concerned on my placement? And you go Google and I'm right at the top. So there's not a lot of competition.
Not a lot of competition, yeah. Awesome.
Yeah.
Well, so do you have any advice? Let's do two forms of advice from you. First would be for a pet owner that's trying to find some solutions for their pet. So tell us what would be some things that pet owners would look for in their dogs that would maybe warrant them trying to find somebody that can do body work.
So I think a lot of times pet parents don't understand what pain looks like. And they assume that when the dog is struggling to get up, get back down, that that's just general, this is old age and this is what's supposed to happen. And that's not always the case. Usually, they might need some supplements, some good nutrition behind it, but massage therapy helps greatly with mobility. And so I had a Chihuahua, the honey badger. I nicknamed him Honey Badger because I couldn't get my hands on him at first. Now I can, but he was having potty accidents, and he's in rescue. And the foster was wondering, is it time? Because he could barely stand up. His back, left leg was shaking, or right leg was shaking, and he would fall down. And his bed was just this far off the ground. And he would go by the bed, look at it. He couldn't get up on the bed. And then once,
Poor thing.
well, yeah, and once she put him on the bed, then he couldn't get down. So he would have potty accidents. I didn't know all this at the time, but I knew that he was falling down and having mobility issues. And so he came to me, and after a few treatments, he was able to get up on his bed. He no longer had potty accidents, and he was running up and down the hall when it was dinner time. So a whole different dog. And also he was less honey badger, because even though he's not the most friendly dog naturally, and he was declared unadoptable because of his attitude, he's actually gotten friendlier. Because
Yeah,
he's not.
I think a lot of people need to know that a lot of times when animals are grumpy, whether it be a dog, a horse, whatever, a
Yeah.
lot of times it's pain related, and the owners will sometimes just think, oh, he's just grumpy in a bad mood, whatever. But that would a lot of times be one of the initial signs that animal's experiencing pain.
Mm-hmm. Roach spine is a good one. I get dogs with a severely rounded out spine, or the head hanging really low to take weight off the painful back end, or the stance. I had one dog post surgery. He was attacked by a bigger dog, so he's picked up and shook, and all of that had healed over, but he had adhesions, and he needed fascia work. So what was happening is the dog could no longer, and this went on for years, couldn't lay down with his head between his paws. He didn't have that mobility, and his stance was really short, not, directly down from the shoulders, right? It was back here trying to support himself. And so we worked through all of that, and it was so wonderful when he was able to put his head completely down on the ground between his paws, and his whole stature, walking and everything, and the roach spine went away. But we get used to seeing the way our dogs is moving today, and these things a lot of times happen slowly over time, or we think, well, my dog had surgery, that's just going to be his new stature. But there's a massage for that.
Yeah, definitely. And as you're mentioning, so if an animal is getting older, they have injuries, for sure they're candidates. But I also think it's important for owners to realize that you don't have to wait for your animal to be displaying signs of arthritis or injuries. If you start them at a young age with the bodywork routine, you can prevent a lot of those injuries.
Absolutely. Absolutely.
Yeah, I mean, even just looking at dogs with like ACL injuries and things of that nature, if they had started that dog on a bodywork routine earlier, they may not have that compensation where, you know, a certain limb's getting more wear and tear than others. So you definitely can prevent injuries, surgeries, and also an owner might say, well, I don't want to invest in, you know, getting a massage once a week or every other week for my dog. But if you look at long term, it could save them money in surgeries, medications, you know, different things of that nature. So it definitely, I think just educating pet owners and letting them know that this is something that will help their pet live a happy, healthy life as they age. It's definitely something we need to spread the word on.
Yes. Yeah.
Do you get many young dogs that you get to kind of help them through their development?
I do get some. And when I started my practice, like I envisioned getting all these young dogs. It's usually the seniors, but I do have some athletes that I work on. And I had one 7-month-old puppy that had a broken femur, had surgery on that, and then needed rehab for that leg. The surgeon wanted to remove the leg, and we worked on her, and she's able to get in and out of the car. Before, she had to be lifted and carried and placed in the car, and she's a German Shepherd, so big dog. That was kind of hard for her mama to do, but yeah. So I get, usually with the young dogs, it's something. I've had vestibular syndrome in a puppy that I've worked on. There's usually something going on, and then you know, the hope is that they keep coming to me, like for, I call them tune-ups, and they come once a month or once a quarter, keep everything going. Yeah.
Awesome.
Mm-hmm.
So lastly, what would you give for advice for somebody who's thinking about doing what you do?
So I would start out networking on social media, get a page that is dedicated to what you do, and broaden those horizons. I had, as I mentioned, no, I didn't know, I only knew Rhett's Vets. That was it. And so it took a while for me to get buy-in here, people with the rescue groups, people to know me, not as a project manager, but as a healer. So I would start that process while you're in training. And then it's great. I find it's great to post before and after. So that's one thing. I tend to get right into the trenches of what I'm doing, and I'm like, later, I forgot to take video, I forgot to take a photo. I now ask pet parents, when I'm setting up their account, shoot me a short video of how your dog is moving today. And I retain that. And then after, I've got the after. So I can post a before and an after on that dog, because seeing is believing. And if I'm talking, it's advertising. Even if I'm not trying to advertise, I'm just trying to share, it can come off that way. But if it's one of my clients talking about it, then it's sharing their story. So I encourage my clients to share, and then when I share, it's a before and after.
Yeah, definitely. I think not only is it good for advertising reasons, but also sometimes the client themselves may forget just how bad their dog looked initially. So it's helpful when you can show a comparison, like remember how they were moving here, and then, you know.
Sometimes I forget. So yeah, it's eye-opening sometimes. Oh, we were back there. And now we're so,
yeah, definitely. Well, thank you so much. I really appreciate your time. Is there anything else that you want to share? Is there any way if people want to find you on social media? Are you active on any of them?
I am active on Facebook, and and through my website. I have my phone number there, and texting me is a great way to get a hold of me. If I'm in the middle of with a patient, I don't answer my phone, but I'll get to my text as soon as I can.
Remind them what your website is again so they can find you.
puretemple.org.
All right, perfect. Well, thank you so much. I hope you have a great rest of your day, and I really appreciate you talking.
You too. Take care.
Thanks.